afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. We're happy to be joined this afternoon by the Mayor of London, Ed Holder, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie, and the Medical Director at the London Health Sciences Centre, Dr. Adam Dukelow. We're happy that you could be with us as well. And a greeting to those joining us from the media. A quick reminder, if you haven't already done so, and we do have a lot of questions in the queue already, use the question form here on Microsoft Teams. Just click on the text bubble with the question mark and submit your question indicating who it's for, your name, and your media outlet. And a special welcome this afternoon to those who are tuning in on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio AM 980 CFPL, and those who are watching on the CTV London website. Lots to get through today, so let's get to the opening remarks right away, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. A couple of items to report with respect to enforcement of local COVID-19 bylaw and public health regulations. According to the Chief Bylaw Enforcement Officer, charges over this weekend were issued of residential gathering, as well as a local bar. Beyond that, it was quiet. Thankfully, we had no issues with anyone trying to venture out into dangerous stormwater management ponds as ice was melting. And again, that's a cautionary comment once again as we carry on through these through the last days of winter, hopefully. Non-skier declared. Today, of course, marks our first day of the orange tier of the provincial government's color-coded COVID-19 response framework. You know, it's been 77 days since we were last in this tier, and it feels like a long and difficult road back. Think of how many individuals and businesses have suffered as a result of the province-wide lockdown from Boxing Day and even over the previous 2 weeks while we were, quote, in red. But after 77 days, it's my sincere hope that these struggles and those sacrifices will not have been in vain, and that our current trajectory with respect to all COVID-related metrics will be maintained. As of today, there is no medium to large-sized region in Ontario with lower rates of COVID-19 than London Middlesex. That's truly extraordinary and speaks volumes about the resiliency and determination of our community. Among other things, a move from red to orange allows for private indoor gatherings of up to 10 people. Restaurants can expand indoor capacity from 10 to 50. Movie theaters can reopen, while gyms and youth sporting activities will also be given some greater flexibility. So at a time when most other large Ontario cities remain under more severe restrictions, I know we do not take our circumstances for granted. I know we don't forget how we got back to this point, and we know what it takes to keep us there. So please support local business like never before, but do it in a safe and thoughtful way, just as we've been doing over these last 77 days. While I have the opportunity, I'd like to give a shout out to Dr. Dukelow and his team and all our medical frontline and healthcare professionals. We are so grateful. And to the work that you and your team are doing, Dr. Mackie, it is sincerely appreciated. Now over to you, please.
Thank you very much for those kind comments, Mr. Mayor. We are indeed in the orange zone starting today, an accomplishment that we should be celebrating as a community. Really tremendous, and over the weekend we saw case counts stay relatively low. There was a high count on Saturday, reported Sunday, 24 cases, but days before and after that in single digits, very encouraging. Still seeing no fatalities recently. That's over 2 weeks now. The other good news is on the vaccine front. We now have stable supply enough over the next few weeks to start increasing eligibility to new groups. There are three main categories where we're able to expand eligibility. First of all, the very high priority healthcare workers under the provincial classification scheme. This would include people who work in procedure-oriented facilities like ORs or radiation centers, clinics where there is hands-on exposure, and one potential staff person being ill could potentially affect many vulnerable people. So it's great we'll be able to offer eligibility right away, and as of now, our booking system is available for healthcare workers in that category. Those healthcare workers do have to be pre-registered through their employer, and we've sent all of the relevant employers information and received eligibility lists back from many of those employers already. The second category we're able to open expansion, including booking right away, is Indigenous people, adults over age 55. So again, this is in keeping with the provincial framework. Indigenous adults over 55 are considered at significantly eligible and significantly increased risk, and so they're now eligible. They can book appointments starting today for as early as March 6th. The third group is adults over age 80. So all adults over age 80 will now be eligible to book appointments. And the only issue with those over 80 is we won't be able to start booking those appointments until 7 a.m. tomorrow. So they will be eligible for appointments starting the same time as Indigenous adults over age 55, but those over 80 will have to wait until 7 a.m. tomorrow to start making those bookings. That's for the online booking system, which you can access through healthunit.com. For the phone booking system, phone line opens at 8 a.m. tomorrow to start assisting those over age 80. Again, the very high risk healthcare workers who have already been pre-registered through their employers can start booking right away, and Indigenous adults over age 55 as well can start booking right away at our 2 mass vaccination clinics that are currently operating at Agriplex and Mount Bridges. Again, I'll turn it over now to Dr. Dukelow.
Thanks very much, Dr. Mackie, and thank you for that excellent work and news on the vaccine front. It's nice to see some significant progress being made as we get into the third month of the year. And thank you, Mayor Holder, for the positive feedback for our team at LHSC. We continue to do our best to serve our community, despite all the challenges we have. I appreciate the opportunity to join you today and update you on the situation at the hospital. And I'm excited to report that we have begun our 4th week with no active outbreaks of COVID-19 within the walls of LHSC. We also are happy to let everyone know that we are seeing a continuing decline in the number of inpatients that are COVID-19 positive. And for the first time since November 12th, we are at a milestone of having less than 5 inpatients that are COVID-19 positive as of this past weekend. We're happy to see that the efforts taken throughout the lockdown and red zone, both in hospital and in our community, have had such a positive impact on limiting the spread, as exemplified by the numbers that Mayor Holder gave us earlier in the call. Our staff, physicians, patients, and everyone in the community is doing a great job, and we are truly appreciative of that. Today's news of expanded vaccine eligibility for additional healthcare worker groups was another positive signal for our hospital, and we're cautiously optimistic about the current situation, but continue to take a balanced approach as we consider what it means for our hospital and community and our ongoing ability to provide safe, high-quality care. Lastly, we're hopeful that our community is also remaining vigilant as we see restrictions lessen and vaccine availability widen. We know that following public health guidance to limit social interaction, physical distance, and wearing a mask has been very effective to date, but also very challenging and had a big impact on individuals' personal and professional lives, but it remains important. If each of us continues to practice these behaviors, we can reduce the risk of seeing cases increase again and avoid a return to the harsher measures we've all lived through in the past few months. Thank you again for taking the time to attend today, and I look forward to your questions.
Thank you, Dr. Dukelow. Thank you, Dr. Mackie and Mayor Holder. Well, we do have a lot of questions in the queue, so we're going to get to them right away. The first one is from Alessio Donini from Newstalk 1290 CJBK. Dr. Mackie. Alessio says, Dr. Mackie, you've said before that the capacity to ramp up vaccination efforts is there, but the supply of vaccine doses is the problem. When do you think the local supply will be great enough that vaccine doses can go into arms at full capacity?
Yeah, it's a great question. The simple answer is we plan to keep capacity ahead of supplies. You know, we see, we get several weeks, at this point, 2 or 3 weeks reliable notice of what the supply will be for the next few weeks. And our goal is to continue to open additional clinic capacity so that we can get those vaccines into arms as soon as they arrive. At this point, our capacity continues to outstrip supply. We have another clinic which will likely be able to open later this month, and a fourth clinic if we need it. So, as much vaccine comes into the community, that's the amount that we'll be able to get into arms.
Thank you, Dr. Mackie. Let's go to our next question. Dr. Mackie, this one is for you as well. It's from Merrick Sutherland, and it's related to Alessio's question. Dr. Mackie, what is the daily vaccination goal for Middlesex-London Health Unit in the short term, and as rollout ramps up? Will it be similar to Grey Bruce, who are aiming for it says 4,500 per day, or closer to Waterloo, who is targeting 10,000 a day? If lower, what are the reasons? So a lot to take in there.
Yeah, we have a roadmap to get to 10,000 vaccines per day if we need to. If our community has supplies for 10,000 vaccines per day, that's what we will deliver. The reality is we don't expect that anytime, before late spring, early summer at the earliest. And so in the short term, the capacity will likely stay between 1,000 and 2,000 per day to match, give or take, what the supply will be over the next month or so.
Thank you very much. The next question is a follow-up from Eric Sutherland. With vaccines beginning to be distributed to those over the age of 80 in other jurisdictions this week, well, here, this is kind of, Merrick maybe didn't see the media release before this went out. He's asking, why is Middlesex-London waiting until mid-March to begin those vaccines? And Merrick, as the release explained, that went out today, those appointments can start to be booked for those over the age of 80 starting tomorrow morning, March 2nd at 7 a.m. for appointments beginning on March the 6th. So let's move on to the next question then. Carrie McKee. Dr. Mackie, come March 15th, which system will the public use to book vaccine appointments? We're hearing health units will switch to the provincial system. Is that accurate?
So, we are examining the provincial system. At this point, the province has asked health units who are doing their own online bookings to maintain that for now, while they transition some of those health units that don't have access at this point to online bookings. So we don't see that happening on March 15th right now.
Right. And a follow-up, Dr. Mackie, from Carrie McKee. When will family doctors be eligible for the vaccine? Some are frustrated given they have patients in long-term care and retirement homes, but have not yet heard anything about when they might be in line for the shot. Would it not be a loss to the system if a family doctor with 2,000 patients got sick with COVID-19 or became a source of spread?
Yeah, the reality is we'd like to have vaccine enough to give to everybody, healthcare workers or others. People have a lot of exposures, and depending on their roles. Lots of family doctors have been able to move to online appointments for many of their appointments, so that's really helpful in terms of reducing risk of spread. But we're following the provincial prioritization. They've laid out which healthcare workers are considered to be highest priority, which very high priority, which one's high priority, and the rest just priority. So we're following that guidance from the province around how to sequence healthcare workers.
And another quick follow-up from Carrie McKee. Dr. Mackie, will members of the public be able to choose which vaccine they get? Some people are saying they want one of the more effective vaccines rather than the AstraZeneca vaccine that has just recently been approved.
So our strong recommendation is that you get whatever vaccine is offered. We have 3 very good vaccines. It's true there's some difference in effectiveness, but any one of those vaccines is far better than not getting vaccinated at all.
Thank you, Dr. Mackie. Question from Merrick Sutherland at CTV London. Dr. Dukelow, this one is for you. Dr. Dukelow, we have heard from 2 independent sources within the hospital that vaccines have been prioritized in some cases for administrative staff, in some cases medical students. Meanwhile, some frontline nurses are still waiting for a first dose of the vaccine. Why would staff with no contact of COVID patients be prioritized over frontline staff?
Thanks very much for the question, Merrick. So the vaccine prioritization is done by our colleagues at the health unit, Dr. Mackie, Dr. Summers, and their team, and is done in lines with prioritization of highest, very high, and high, which you heard Chris refer to a few minutes ago. Students of all types, though, within the walls of LHSC, including medical students, but nursing students and other disciplines, have been getting vaccinated if they spend the majority of their time in areas identified as in that highest category, so ED or emerge, ICU, and otherwise. Other students will be added today, given the expansion to the very high group. And lastly, a comment on administrative staff. Certainly, administrative staff that do not have patient contact would not have been included in the prioritized groups to date. So I would need to know more specifics of that case to understand why an individual or individuals received the vaccine that were within the prioritized groups.
Thank you, Dr. Dukelow. Next question is from Jennifer Beeman at the London Free Press. Dr. Mackie, will mobile vaccination teams be sent to places with high concentrations of elderly people, such as the Cherry Hill neighborhood? Does this strategy depend on the arrival of more cold chain stable doses, such as AstraZeneca?
So, we certainly are looking at where our mobile teams would go next. There are a number of locations which would be high risk from various perspectives, including the age of the population. We also know that, the shelters are high risk places as well. We have limited capacity for outreach. It's much more efficient to use the kind of a pull model to bring people into those mass vaccine sites. And so we still are doing, around 150, 200 people through those mobile vaccine teams per day. But, there is limited capacity there, and absolutely crucial that we maximize the use of the mass vaccination clinics. They're so much more efficient in terms of staff time.
We've got a couple more questions from Jennifer Beeman for Dr. Mackie. Dr. Mackie, will the health unit post the number of vaccine doses administered on its dashboard? Will these be broken down by category, such as healthcare worker, care home resident, that sort of thing?
Well, we're certainly planning to post those vaccine numbers as soon as we have direct access. At the moment, KPMG is managing the local reporting of vaccine doses. And in order for the health unit to use those, I believe, we're moving towards posting those as soon as we can. We haven't made a determination about what level of breakdown those would be. And say, right now there are still limits to what data we can extract from the provincial vaccine tracking system. But we'll have as much as we can to you as soon as we can, Jennifer.
Thank you, Dr. Mackie. I'm going to go down a question from Jennifer Beeman for Dr. Dukelow. Dr. Dukelow, how many LHSC staff have been vaccinated?
Thanks, Dan. The way the reporting works, we actually don't have access to individual health records to understand if someone has been vaccinated that works at LHSC. However, we do have some self-reporting set up. So people that are vaccinated can register with occupational health. They've been vaccinated. And so I will be able to get that number to you. I'm just waiting for it. So actually, just received it. Sorry, it's about 155 physicians, 200 resident physicians, and 950 LHC staff have self-reported that they've been vaccinated. So it looks like a total of about 1,400.
All right. And I do know that, and it was included in the release that went out just before the virtual media briefing, just over 33,000 doses administered since the 23rd of December in London and Middlesex County. So that number continues to grow. Dr. Mackie, question for you from Andrew Graham at Global News Radio, AM 980 CFPL. Dr. Mackie, where do frontline workers fit within the local vaccination program? What about those who are immunocompromised?
Yeah, so one of the criteria for the provincial prioritization of healthcare workers is whether the individual is frontline. And just to be very clear, there's varying degrees of frontline. The people in the highest category that have already received vaccine at this point are those who are involved in aerosol generating procedures, particularly in unstable environments, potentially intubating in the field. The next level that we're entering into, as announced today, is really about those who have, hands-on, face-to-face contact with patients. So interventional sort of inpatient clinic environments. Those are sort of considered to be the next risk from the perspective of, if one healthcare worker became positive, they could potentially expose many patients and other staff. So those are the very high priority healthcare workers that are the frontline workers that are being offered the vaccine as of today in this region. Around immunocompromised, this is an issue. It's also one that potentially has drawbacks from a vaccination perspective, in the sense that, immune compromise means you won't necessarily get the same immune reaction in terms of the effectiveness of the vaccine. And so if somebody is in one of the groups that is currently eligible, healthcare worker, for example, and they have immune compromise, there's no reason not to get the vaccine. But immune compromise by itself doesn't place the individual ahead of others in terms of prioritization in the current framework.
Thank you, Dr. Mackie. Travis Dolany is up next from CBC London. I'm thinking this is for you, Dr. Mackie. Toronto Public Health announced they're prioritizing vaccinations for people in the shelter system. Will the MLHU prioritize people experiencing homelessness here?
Yeah, so we learned through the media about Toronto Public Health prioritizing those in the shelter system. At the moment, shelters are not eligible according to the provincial framework. Again, media reports suggest that the province opened that up in Toronto. We haven't received any direct communication about that. So it's certainly a group that we're considering. We hope to be able to offer vaccine in shelters either later this month or early next month, but we don't currently have permission from the province for that. We'll be looking closely at any official communications that come out there.
Thank you very much. Jane Sims has a couple of questions, Dr. Mackie. Jane, of course, from the London Free Press. Dr. Mackie, by moving ahead the timeline for the 80-plus crowd, what does that mean for younger people? Can we expect that we might be moving into phase 2 sooner than later? Does that mean that those of us under the age of 60 might be able to get a shot before August?
The big game changer around that, Jane, was the announcement of AstraZeneca last week. The General Rick Hillier, who leads the provincial task force implementing the vaccine campaign, had announced last week some of the figures around which groups would be eligible when, and it looks like the provincial government was targeting 75 plus by mid-April, 70 plus by May, 60 plus by June, and then others after that. With AstraZeneca becoming available, that will potentially accelerate eligibility for those younger demographics. We don't exactly know how much AstraZeneca is coming when. Once we do, we'll have more of a sense of how that impacts timing across the board, but very early days, and we haven't had any indication of when we would get access to additional supplies in this region.
And Jane has a follow-up for you, Dr. Mackie, to clarify the 3 groups that can start booking appointments, or they can start booking appointments, but they won't be able to start getting shots until March 6th. Why is Middlesex-London later in offering shots to seniors than Chatham-Kent, Windsor, Waterloo, and other areas?
So first of all, there are different 3 groups today. Each has a different combination of the date when they can start booking and the date where they start receiving vaccine. Healthcare workers in the very high priority group are clearly early phase 1 according to the provincial framework. As of today, if they're pre-registered with their employer, they can both book and receive a vaccine by end of day if there happens to be space in one of the clinics. The second group, Indigenous adults, the bookings are open today. The appointments start March 6th. The third group, 80 plus, bookings are open tomorrow as of 7 a.m. The appointments start March 6th, same time frame as the Indigenous adults over 55. On the question of who is offering 80 plus vaccinations when, it's really a function of availability of vaccines and progress in the campaign. Different communities have received different amounts of vaccine at different times. And that has meant that, and primarily earlier on, it was because, Windsor, Toronto, these sorts of communities were being harder hit by COVID. So they actually received much larger shipments of vaccine earlier on in the campaign to make sure that their long-term care and retirement homes could be vaccinated as quickly as possible. So that has put them essentially ahead in terms of how many people in their region, healthcare workers, long-term care, et cetera, have been vaccinated at each stage along the way. That means that different health units can offer vaccine to the 80+ group at different times. I think, certainly in the first half of health units, the provincial target was offering vaccine to 80+ by March 15th. We'll be well ahead of that. And so from that perspective, I think we'll be in a good position as we move into wave 3 with our highest risk citizens starting to get vaccines this week.
And a follow-up question from Jane, Dr. Mackie. Do you expect the Johnson & Johnson vaccine to be approved by Health Canada? How much of a game changer would the one-shot vaccine be in terms of speeding up vaccination timelines?
Yeah, the Johnson & Johnson vaccine certainly would help. One shot makes it easier. The storage is easy with that vaccine. It could be very helpful. It's similar to the AstraZeneca vaccine in terms of its effectiveness, kind of mid-range effectiveness. It's not the 90% plus of the Pfizer or Moderna, but still a very helpful vaccine. We don't have visibility at the local level. The decisions and analysis really happen at the federal level, and we're sort of the third level down to hear about when we would get those supplies. So we haven't been told about anything around Johnson & Johnson coming in the foreseeable future.
And we've got the last question in queue right now, unless someone sneaks one in there before the end, from Jennifer Beeman again at the Free Press, and this might be a good one to sort of wrap things up with. Dr. Mackie, is the website ready for the flood of appointment requests? How many people does the health unit have manning the phone lines?
Yeah, I appreciate the question. So we're working, the booking system is called Virgo, and it's actually something that LHSC has been kind enough to share with the health unit for all of the local bookings. It's a solid system. It's been around for some time. We very much hope and believe it will be ready. Phone lines are another issue. City of London has been a tremendous partner there, has offered up staff in their emergency operations center, who will be available for phone bookings. They've had their training this morning and are ready and probably already taking bookings this afternoon. So big thanks to the city for the partnership there.
Thank you very much, Dr. Mackie. And that does bring us to the end of our questions for this afternoon's virtual media briefing. I'd like to thank you for being here and for joining us, and a big thanks as well to Mayor Holder, Dr. Mackie, and Dr. Dukelow for their information, their insights, and all the work that is being done to make all of this possible. Finally, thank you for your time, and we will be back with our next virtual media briefing on Thursday afternoon at 2 o'clock. We hope you'll join us then, and until Thursday afternoon, take care, and we'll see you then.